Let's talk a little bit about high blood pressure, known as hypertension, today. So, what is high blood pressure? It's a condition where the walls of your blood vessels or arteries are subjected to a lot of force. Over time, this can lead to stiff arteries and increases the risk for heart attacks, strokes, and other health conditions. High blood pressure can result either from risks that are innate to the individual, such as increasing age, obesity, physical inactivity, poor diet, etc. This is called primary or essential hypertension. High blood pressure can also be caused by other factors or conditions, such as certain medications or underlying medical conditions like thyroid disease, sleep apnea, what have you. And this is called secondary hypertension. When we speak of your blood pressure, we usually use two numbers. The top number is called the systolic blood pressure, and this is the measurement of the blood pressure in the arteries when the heart is pumping or contracting. The bottom number is called the diastolic blood pressure and measures the pressure when the heart is at rest and filling with blood. For adults, a normal blood pressure is considered to be reading less than 120 on the top and less than 80 on the bottom. There are different stages or severity of high blood pressure, but for the sake of simplicity, anything greater than 130 on top and 80 on the bottom is diagnostic of high blood pressure. You can see in this graph the different stages. Most people will not have any symptoms of high blood pressure, which is why it is often referred to as the silent killer. When there are symptoms, they can range from fatigue, headaches, and blurry vision to dizziness, chest pain, and even palpitations. So, if you have noticed that your blood pressure has been elevated, have had any of these symptoms, or you simply haven't been feeling well lately, please see your primary care provider to get attention. Thank you for watching, and I hope to see you in a future video. If you would prefer this material in Somali, you can also find that on my channel.